everyone. Got a question for you. So, should LED be performed before or after a treatment? I get asked this a lot, if not weekly, then every few days. So, I'm here tonight to smash that question out with you. When people often ask this in the industry, other maybe educators and manufacturers, they are often given a really simple answer. But the reality is, it actually depends because LED is just not an add on treatment, it's a biological tool. And how you use it can either enhance your results or limit them. Good evening, everyone, and welcome to tonight's Tuesday Clinical Conversations. If you're new here, I'm Nancy Abdu from the Australian Dermal and Laser Institute. I work with clinics on treatment planning, device protocols, and helping clinicians get better outcomes, not just perform treatments. And LED is one of the most underutilized and misunderstood tools in clinic, or sometimes it's overused. You heard that right. Sometimes it's actually overused. So tonight I want to simplify the science for you. No confusion, just clarity. But before we talk about whether LED should be used before or after a treatment, what I really would like you to understand is what it's actually doing. So those of you who are watching right now, if you do have an LED, just send me a bit of a like or a thumbs up, and maybe you can tell me what's your favorite wavelength. So let's have a look. Let me have a look at your comments. And if you're jumping on here, make sure you say hello so I can see that you're on as well. And looks like we've got a few people on. Great. Like I said, let me know what your favorite wavelength is and what interests you most about LED. So while we're waiting for a few people to respond, I want to actually go through and walk you through how LED works. And LED actually works through something called photobiomodulation. Whenever you see the word photo, it means obviously light. And when we've got the word modulation, we're actually modulating. It could be a signaling pathway, or it could be a cellular response. So we're actually modulating that cell functionality through photons or light. So I can see Sam's got red. Yes, red and green. I love green. If you know me, you'll know that I love green. I love red too. Don't think otherwise. But green's one that I advocate for a lot. But what actually photomodulation does and what it means is how the cells actually behave with the exposure of various wavelengths. And this can affect ATP production, so adenine triphosphate. It can affect the inflammation pathways, wound healing, the bacterial load of the skin, fibroblast activity, cell communication, wound healing. There's so many different things that can actually affect or help. So it's not just actually calming the skin or for fine lines and wrinkles, as I oftentimes will hear that. People often will say, oh yeah, red LED, it's great for wound healing or great for stimulating collagen. But it's not just that, and it depends on the actual wavelength that you're utilizing. But LED actually influences how the skin responds to what we do. It doesn't just treat the skin, it actually changes how the skin behaves. So this is where the timing is really important. So whether you use LED before or after, it depends on a number of things. It could be your treatment goal. It could be dependent on the condition of the skin, the level of the inflammation you're actually creating with other devices or other treatments or peels, the wavelength you're using, And there's not one particular, timing that's going to be correct. Like not all skins are the same, are they? I can see here, Amanda, you said red and green for me too, and NIR, near infrared. Yes, all amazing wavelengths. So, like I said, not all one size fits all. But before we go into timing, I want to talk to you about something a bit, well, rather critical, rather. And not all LEDs are the same. So the wavelengths you choose will determine the results you get. But let's just break down. There's actually there's so much I want to go through tonight. But let's just go through what the different wavelengths do. And then I want to talk about energy and if there's something such as too much LED, because there actually is, you could be doing more damage than good. And then I want to also talk about the spacing between the panel and the person's skin and also dosing. So there's a lot to go through. So be patient with me. Hopefully I've got enough time to get through it. But let's talk about the different wavelengths. So blue is roughly 415 to 420 nanometers, depending on your device. And that actually works by interacting with the porphyrins. So the porphyrins are produced by our acne lesions causing bacteria, which actually creates a bacterial effect. And so clinically we use blue light for active acne, for congested skin, for breakout prone skin. And it's not going to be calming or wound healing. It is just antibacterial. So it's controlling the bacterial load in the skin. And so with blue light, we do need to be careful, because if we're exposing the skin to too much blue light, right, whether if it's because the dosage is too high or the client is under the LED for an extended period of time, you might find that that client may present with what I call a tan. It's actually exciting the melanocytes and stimulating that melanocyte activity, and so you might end up with a bit of transient post-inflammatory hyperpigmentation. So just be mindful of that. But moving on, we have then got green, and green can be roughly, depending again on the device. Depends on the device. It could be anywhere from 550 to say 580 or 590 nanometers. And green, I feel like it's very underused. There isn't a lot of clinical studies, I agree, but it's what I see anecdotally in the clinic. Like we've been using green in our clinics for over 20 years, and it's just what I see. And what I see is it's very calming, it's very soothing for the melanocyte. It calms that melanocyte down. For vascularity, it's quite I would say soothing on the vessels, and so we find that we get a bit of a vasodilation happening, and also it's great for migraines and headaches too. So that's a completely different kettle of fish, but really it's quite calming and soothing. The other thing it actually has been proven to do is it helps with epidermal healing, so more superficial healing than dermal healing. And so we know green LED can help with uneven skin tone, mild pigmentation. In some instances, I've seen amazing results with melasma. It's really good for rosacea as well. And it's actually great for maintenance treatment in between other aggressive, stronger treatments. So you need to remember, however, it's not a standalone treatment for pigmentation or rosacea. It is a supportive tool, and we must treat it like that. But I have seen good results using the green LED wavelengths. Sharon is saying, my clients who are feeling anxious or stressed, green really calms them, not just the skin, but their emotions. It's a very soothing wavelength. And back to the migraine and headaches, what I mentioned earlier is if you have a client who has that migraine or has a tendency to have migraines, if you can turn your LED brightness all the way down to its lowest and have their eyes open, the light must actually travel through their retina and expose their eyes to only 5 minutes, depending on the strength, 5 to 10 minutes of LED for about 3 or 4 times a month. It'll actually help with their migraines for the rest of the month. So green is so understated, and there is a lot of clinical studies with green. So if you just type in to AI or Google green LED and migraines, there's actually a lot of studies about the effects of green and migraines and headaches. So yeah, all you need is 5 minutes. Now, another favorite of mine is red. So red is one of the most commonly used wavelengths, roughly around the 630 nanometers. It's probably the most highly studied wavelength. We know that it actually stimulates the mitochondrial activity, where it increases your ATP, and it supports that fibroblast production. So the way I liken it to is if your battery, your skin, now let's take it back to a remote control battery. If that remote control battery is weak, dying, or it's dead, and you press play on that remote control, what happens? Nothing, right? That remote control is really sluggish, or it just doesn't work. So if I put new batteries in the remote control, the actual remote works the way it's supposed to. You press play, you press record, and it works the way it's supposed to. Our skin is very similar. In our mitochondria, we have ATP, cellular energy. By the time we reach 60 years old, those ATP levels have actually reduced by roughly 50%. So what that means is if I have a cut on a 20-year-old and I have a cut on a 60-year-old, that 60-year-old is not going to heal the same as a 20-year-old, are they? Because that cellular energy, those batteries for the older mature client has actually depleted or dropped. And so if I recharge my skin cells batteries and give it more ATP, then when we come to needle someone or do laser genesis or IPL them or radiofrequency or HIFU, whatever the treatment might be, that skin is going to work like a young skin should, and it does. So red LED is great for healing, so to help with post treatment recovery. We know then it's going to help with stimulating collagen and elastin, and because we're increasing the ATP, it's great for general rejuvenation. So we know red light supports how the skin repairs and heals and regenerates. The other thing is, and this isn't often talked about, LED is amazing for hair regeneration. And it's not just for hair regeneration, it's for regeneration for any cell in our body, actually. So there comes that question, if someone has or had cancer cells, are we actually causing those cells to replicate potentially? So you need to be really careful when we're treating clients who have had a history of cancer, that you get clearance by their doctor, and in fact, I just won't treat them. But that's just, again, a topic for another day. And yes, Sharon, thank you so much for your comment. So scarring, it definitely is going to help with scarring. So any type of rejuvenation, like I said, that includes, hair regeneration. I know many more clinics are getting into hair stimulation and hair regeneration. Your red wavelengths are going to be amazing for that. And then we've got near infrared. So depending on the device manufacturer, it could be 830 nanometers, 850 nanometers. Some will go even deeper. And I know there's yellow in between there as well. So yellow is good for bruising and burning and your lymphatics. But then your infrared is a little bit more, I'd say, penetrates a bit deeper into the skin. And so for that, we use it more for your deeper inflammation, edema, and that deeper swelling that you've got. So deeper tissue healing, definitely great for post-device treatments and for supporting recovery at a deeper level. So near infrared is where we start influencing deeper biological processes, not just at the skin surface. The other thing that isn't also talked about with infrared is it's great for our brain. So if you've got your infrared, you'll find that it actually will help with someone who's got, say, Parkinson's. It'll be good for people who post-stroke, for regenerating that grey matter. And it does that by increasing the synapses, which is the cell-to-cell signalers in the brain. Really good for red and infrared, really good for depression, for increasing those feel-good chemicals in the brain. So LED isn't just for the skin. It actually helps with so many things when you actually delve a lot deeper. Like I said, all you need to go into or onto is, whether it's PubMed, Mayo Clinic, and have a look at peer-reviewed papers. There's just so much information. If not, either AI can help you with that as well. So when we talk about LED, we're not just choosing a wavelength or a color. We're actually choosing a biological outcome, right? And so we know blues for bacteria, greens for pigment and superficial, redness, reds for healing and collagen induction, and infrared for our deeper repair. So let's have a look at timing, because when we use LED before a treatment, we mainly use that for prepping the skin. So with that, I say it's for recharging the skin's batteries. So before I'm doing a treatment, like I mentioned before, we make sure that we can get the best out of that skin by recharging those skin's batteries. And so we do maybe 3 or 4 LED sessions, if not more. I prefer to do a hell of a lot more. But if you can only fit in, say, 3 treatments beforehand, it's better than nothing. And that way it's going to help with increasing your ATP, so cellular energy. It actually will also help with reducing that baseline inflammation. We don't want too much inflammation in the skin. We want a little bit, because a little bit of inflammation is okay, but when we've got that overshooting low-grade inflammation, it actually decreases the type of collagen that's actually being synthesized. So that's really important. So it's going to reduce that baseline inflammation. It's going to help with circulation, and we know that by increasing circulation, we're going to get more blood to the area, more oxygenation, more toxin clearance, better vitamin and oxygenation to the area, and so forth. It's going to help with prime cellular activity, and it's going to help improve your tolerance to the treatment, which sounds like a bit of a mixed sort of message I'm sending you. You want to make sure your skin can tolerate the actual treatment that we're about to, put them under. We're going to put the skin under all of this stress. And so by increasing ATP in the skin, you're going to improve their tolerance to that particular treatment. And that is especially useful for sensitized skin, for skin who've got, the rosacea, they're someone who's got inflammatory skin conditions, someone who's got a compromised skin barrier, and maybe even for clients who haven't had a lot of prep work done. So that's not just for those clients, but especially for those clients. And I've already mentioned inflammatory skin conditions, so that's great. So pre-treatment is about preparing the skin to allow it to respond better and to behave the way we want it to. Like I said, not a lot of inflammation and more collagen induction. When we use LED after a treatment, we're trying to control the healing process. And so you need to be mindful, what are we trying to do? And people always ask me, Nancy, do I do LED before or after? I think if you've got an inflammatory skin condition, then you want to do LED before is great, but also you want to treat the skin with LED immediately afterwards. And the reason for that is the skin is already in a heightened state of that, inflammation, long-term chronic inflammation. And we're just about to add in more inflammation what you're wanting to do is you want to reduce that inflammation we've created pretty quickly. And so we're not getting a degraded collagen or heightened inflammatory response. So my answer is before and after. If we're treating melasma, if we're treating rosacea, if we're treating inflamed acne, if we're treating someone who has got quite an impaired skin. And so that way you can reduce the inflammation, you can accelerate recovery, you can really support that collagen production, and you can improve those outcomes. So post-treatment isn't just about calming the skin, it's actually controlling how the skin heals. And so that's where you need to choose, is it before or is it after? When we're dealing with collagen induction, I always say it's before. And if we're treating, for inflammation in the skin, then it's going to be a bit of both, but in particular after. Give me 1 second. Yes. All right. Michelle, I wish I could put your knowledge in a textbook. Oh God, I'm so glad that you're enjoying this. I love parting knowledge. I love giving away this knowledge. I think there's nothing worse than having the knowledge and not sharing it, right? So why not? So thank you so much, Michelle. That's so kind of you. All right. So back to what I was saying, LED, it's not one size fits all. Sometimes it's before, sometimes it's after. Not all wavelengths, can be used in the one treatment. Sometimes you will. So let's have a look at a bit of a case study, for example. So if I've got someone who's got inflamed acne and I want to reduce the inflammation and they're quite pustular, what do you think we're going to do? We're going to use blue for antibacterial. We're going to use red to increase wound healing, right? And if you've got green's going to reduce the amount of inflammation at a superficial level. Would you do all three wavelengths at once? No, it's not, because, and I've heard this before, believe it or not, the wavelengths, the skin gets confused with the wavelengths. That is not true. Blue has a certain depth of penetration, green has a deeper depth of penetration, and your red has even a deeper depth of penetration. They're three separate wavelengths at three different levels of penetration. Could you do them together? Yes, the skin's not going to get confused, but what is going to happen is it's going to be overstimulating, and in particular to the melanocyte. And this is where we're going to get that melanocytic activity, and you'll end up with a bit of PRH. Albeit it's transient, but nonetheless, no one wants a tan that they weren't asking for. So those three wavelengths is what I'll be, delivering to the skin. I might do my antibacterial first, do my treatment, and then I can do my red and green, or the other way around. I can do my green, my red beforehand to increase ATP, do potentially a needling treatment, and then I can do my blue because it's antibacterial and green because it's calming. So you can have more than one wavelength and do it before and after the treatment. You have a look at the skin and see what we're dealing with. Let's say you're treating someone for collagen induction, so fine lines, wrinkles, scarring, stretch marks, and you're thinking, what do I do, before or after? Definitely red before, and if you want to add in, say, 10 minutes of green after, just to help with superficial inflammation and superficial healing. It increases something called the HACAT cells. I think I've got that right. HACAT, I think it is, cells. It's the epidermal cells anyway. And so you can do a bit of red, like I said before, and a little bit of green. I wouldn't do infrared. Infrared is going to potentially inhibit that inflammatory response we've just created. So I would leave that for a few hours later, which clients probably won't, wait around for a few hours. But you can do that 24 hours later. A little bit more of that red, a little bit of infrared 24 hours later. So you could easily combine, or you can do one wavelength after another if your device does that. And that's what I love about the Quad Lux. It is all hands free. I can synchronize them so they can turn on one after another if I want. And they're like between 5 to 10 minute treatment times. And that comes down to dosage. So let's talk about dosage. But before I do that, there's a couple of questions here. Sharon's saying my clients are 60 plus up to 86. Awesome. And the treatment I offer is cleanse papaya, so an enzyme peel, LED green and red, 8 minutes each. There's a hyaluronic mask. Would you agree? Clients are 60. Treatment is cleanse, peel. Okay. With the papaya peel, is it colored or is it see-through? If it's completely see-through, you could do your LED straight on top. LED green and red, that's fine. That and the hyaluronic mask, I mean, again, if the hyaluronic mask is clear, you can do your LED on top. If not, you'd have to do one, the mask and then the LED. Kayla, would you suggest LED? Oh, Sharon, okay, so it's clear. So are you doing it on top? If it's completely clear, and you're not going to lose any of that light going through the actual enzyme or the hyaluronic, you can actually do them at the same time. Save some time with your clients. Why wouldn't you? Great idea. Kayla, would you suggest LED with pigment melasma skin? Really good question. Okay, so LED, if you've got too much exposure to LED with someone who's got pigmentation or melasma, you do need to be careful, because if you're overexposing the melanocyte, and you're potentially going to be actually making your melasma or pigmentation worse. So you need to be really careful with how much exposure and how much dosage you're, irradiating into that skin, right? So that's going to be really important. Darker Fitzpatrick's in particular. So if you've got, say, a dark 4, a 5, or a Fitzpatrick 6, you're either going to not use those wavelengths, or if you don't have infrared, so you'd use infrared instead of, say, red, or what you'll do is you'll shorten your treatment time, or you actually increase the distance of the skin. And so we know roughly between 5 to 8 centimeters is how far your LED panel should be off the skin for optimal energy absorption. But for darker Fitzpatrick's, because there's more absorption, remember I always talk about black cars and white cars. Black cars absorb, white cars reflect. So a darker skin type's going to absorb a lot more of that photon energy. What you're going to do is you're going to move that LED panel a little bit further away to reduce your dosage. Now, you've heard me talk about dosage a number of times. Let's have a look at what that actually is. Are there any more comments? Okay, great. So dosage is a bit of a mathematical equation. We've got our watts multiplied by, or your joules. That's your watt centimeter squared by time is going to give you your dosage. Now, there's something called biphasic dosage. And what that is, for example, if I give you a quarter of a Panadol versus 100 Panadols, right? A quarter of a Panadol is not enough. You're underdosing, that medicine, right? So that's not enough. On the other hand, if I've given you 100 Panadols, you're overdosing, and it's actually lethal, right? It's the same thing with LED. Not enough LED, we're not doing a great deal. You might be doing a little bit, but just not enough to have a therapeutic change in the skin. On the other hand, if I'm exposing that skin to an extended period of time, you could be doing damage to the skin. And so knowing how much power your device delivers and what the right dosage is critical and something you need to be asking your device manufacturer, because dosage is going to be so important. So I'm just going to quickly bring up a document for me just to, here we go. So depending on the wavelength, let me just have a quick look. Depending on the wavelength, what does overdose actually do to the skin? Here we go. So there's something called the Arnold-Schultz law. So, or not Arnold, Arndt-Schultz law. And that is the reason overdosing with LED causes harm rather than accelerating results. So the Arndt-Schultz curve, so no effect zone, so that's not enough light, that's like having that quarter of a Panadol. So the dose is too low to trigger a cellular response, light is absorbed but no meaningful biological cascade initiated. Then we have the optimal stimulation zone. So this is our therapeutic window where, and this is mainly talking about red LEDs, cytochrome C oxidase in the mitochondria absorbs photons, so the light wavelengths, increasing your ATP production, nitric oxide release, and collagen synthesis. Inflammation is modulated downward, cells repair efficiently. And then you've got the overdose, so the inhibitory zone, and this is where it becomes harmful. And this is what happens is excessive photon absorption overwhelms the mitochondrial electron transport chain, generating surplus reactive oxygen species, ROS. The cell switches into a stress response, halting regeneration and triggering inflammation rather than suppressing it. All right, so this is where dosage is really important. You need to know. I did a little bit of training last week and we were talking about dosage, and this is like, they've had a number of LEDs that they've purchased before through other companies, and I've said, have you done your LED training with these other companies? What have you learned? And they're like, no, we were just told to turn on the device and put it on maximum. And it's like, how? There's something called this dosage. There's a therapeutic window that you need to be aligned with, so you're not under or overdosing the skin cells. So let me keep reading. What overdose does to the skin? I know we've gone over, but I can't help it. It's LED, I love it. When LED energy exceeds the therapeutic window, the following changes occur at a cellular level. So reactive oxygen species surge. Instead of the brief controlled ROS burst that signals repair, overdose produces sustained ROS generation. This causes oxidative damage to the cell membranes, proteins, and DNA, the same mechanism underlying UV-induced photoaging. So we're doing the opposite if you're exposing the skin to too much. Then we've got collagen synthesis inhibition. Studies confirm that doses beyond roughly 20 joules per centimetre squared on a superficial skin tissue can reverse fibroblast stimulation, slowing collagen production rather than accelerating it. The biphasic peak for wound healing has been observed at just 2 joules centimetre squared, with a high dose of 50 joules per centimetre squared actually worsening healing outcomes compared to untreated controls. And that comes from a clinical paper from Hablum back in 2010. And then we've got inflammatory rebound. Overdose activates pro-inflammatory cytokine pathways, interleukin 1 beta and TNF. So TNF is alpha. I have to have a look what that is. My brain's gone to mush. TNF, natural factors. Anyway, rather than suppressing them, skin may appear red, feel sensitized, and break out as the barrier function is compromised. Then you've got melanocyte hyperstimulation. For conditions such as melasma and post-inflammatory hyperpigmentation, overdose, particularly with the green wavelengths, can paradoxically stimulate melanin production rather than modulating it, worsening pigmentation. And last of all, mitochondrial shutdown. At very high irritances or cumulative overdoses, so multiple, exposures, cytochrome C oxidase becomes photoinhibited, so suppressed. Cells produce less ATP, not more, entering a low energy state that impairs all regenerative processes. So, is there such a thing as too much LED? Hell yeah. Know what your dosages should be. Ask your manufacturer for these proper dosages and times, and that is why, like I said, with the Quad Lux, we have 5, 8, 10 minute, even 11-minute treatments. We don't have 20 minutes because there is something called overexposure, as you know, and so that could be problematic. The other thing that's important is your distance between the skin and the panel. That actually will make a difference. Having too long a session, right? So if your sessions are way too long, more than they should be, you're overdosing. Having too much of power output percentage, so running at 100% power at 5 centimeter for 15 minutes, for example, depending on the LED, can be just way too much, and too many sessions, of course. So if you've got 2 sessions per day, that's way too much, depending on the dosage of your of the actual device itself, and depending on the client's skin. So hopefully that gives you a little bit of insight. It's something that's not often talked about. Let me see where you all are. It's not something that is often talked about, and when I'm going to training, a lot of people actually don't even know about the Arndt-Schultz curve, and I think it's really important. Okay, so we've gone way over time. Last question we've got, would you use yellow for pigmentation? Depends, tell me what the exact wavelength is. You could get some assistance with pigmentation, but really it is that green wavelength that is actually quite inhibiting, more so than yellow. I find that yellow is great for bruising, for burns, if someone's had a burn, and for lymphatic, because it penetrates a little bit deeper than that melanocyte that we're trying to target. Sharon, you asked the question about my machine offers 640 and 532 green, Amiga light frame. Is this okay for 8 minutes for both red and green? It comes down to the type of LED. Is it a COB LED or is it a SMD? Is it chip on board or not? And it depends on how many, it depends on the irritants. So you're gonna have to get that information off your manufacturer. We're running out of time. Hello, Narita. Kayla, would it be overdosing if you put LED on the face and then the body within the same session? No, because we've got 2 different exposure points here. How about PDT? So SEMA, PDT, photodynamic therapy, what wavelength would work best? Are we talking about in conjunction with ALA? And that's usually done, delivered with a nurse or under a doctor's care. So that would be out of scope of practice for a beauty therapist. So again, for PDT, and if you're working with, cancerous cells, you would have to work with your manufacturer to get those guidelines. Oh my gosh, I haven't even delivered everything that I was supposed to deliver, but I don't know, do we continue this next week maybe? Oh, what else did I have on the agenda? Oh gosh, combining, we talked about combining, before and after. I think we covered everything. So anyway, hopefully that has been amazing for you. But before I finish tonight, if you've been enjoying these lives with the education we're sharing, we've been nominated the ABR Wholesaler of the Year for 2026. If you believe in education first and raising standards in the industry, I would really appreciate your vote. I'm going to put the link in the comment, but look, thank you so much for joining me tonight. If you have any questions, just drop them down below. I'm going to go grab some dinner. Actually, I have to still make my dinner, but I'll answer them a little bit later on tonight. But I will see you next Tuesday at 8 p.m. I believe I've got Carly Knowles joining me talking about marketing your device. It's going to be one that you do not want to miss. Oh, is it next week or the 21st? Might be in 2 weeks actually. Anyway, but yes, let me see your faces next Tuesday, same time, same channel. I'm going to have a quick look at the responses once more. You are so welcome. All right. Have a great night, everyone. Bye.